Hello and welcome to Ask Dr. Walter Salubro. This is a brand new series and segment on my YouTube channel where each and every day I'm going to answer either 1, 2, or maybe even 3 questions that you leave in the comment sections under my videos. These questions will be answered in a video format and will be uploaded each and every day. At minimum, at least 1 question will be answered, and again, maybe 2, 3, or 4. Why? Because I want to be able to connect with you a little closer and a little bit more personable and interact with you through these question and answer videos each and every day. So do follow along each and every day. As well, another key thing is I want to give you hope, and I don't want you to lose hope if you've been suffering with chronic ailments with your back, your leg, your neck, chronic disabilities possibly because of chronic pains. And one of the key things that I want my patients to get also, not just my followers and viewers on YouTube, is that you do have a chance to heal as long as you're directed in the right way. And perhaps you may need some answers and guidance along the way. So that's what this is about, is to give you hope and give you inspiration and to help you to never give up. Don't ever give up if you're struggling. Try to look for the answers. If I can help guide you along, that's what this series is about. So do follow along each and every day. So today I have this question right here, and this is by Evita. This is what Evita said. She said, "Hi, thank you for your video. Currently, I'm under very intense pain. The inflammation is huge. I had to rush to the ER because I was crying. I couldn't sleep or eat. I couldn't stand or walk. My question is, do I have to take care of the inflammation first and then start with this exercise, or should I try some of them slowly? Thanks in advance." That's a great question by Evita, and it's something that needs to be addressed properly. If you are in a lot of pain, intense acute pain because of a disc injury or any other type of injury to your back or neck, and you're wondering what to do in the immediate, well, first you need to address the inflammation first. And there's many ways that can be done with. It can be done with chiropractic adjustments. It can be done with physical therapies like modalities like laser. It can be done with acupuncture. It can be done with ice packs. It can be done with medicines, of course, through your medical doctor or medical specialist. But it's hard to get into exercises, whether it's functional exercises or corrective care style exercises, structural rehabilitation style exercises, when you're inflamed, when your joints are inflamed, when your nerves are inflamed, when your discs are inflamed. It's not easy to do the exercises when you have lots of inflammation, and it won't be very pleasant to you, and the compliance will be very low anyways, and it's just going to hurt. So what we do in our office is we do not start our patients on exercises immediately, especially our patients that have a tremendous amount of acute inflammation on their spine, on their spinal joints, ligaments, discs, and even nerves, and especially our disc bulge patients. We start off with relief care at the beginning, where we're mobilizing and adjusting the spinal structures, getting them to function better, getting them to move better, give them some ice recommendations to do at home. Medications, we don't advise on that as chiropractors. That's up to the patient and their medical doctor. So we address the acute pain and irritation first. After several visits and maybe a week or 2, when the pains begin to subside and the inflammations begin to subside, then we'll start with some postural corrective exercises. Then we'll start with some home traction exercises, and then structural rehabilitation exercises like traction on the spine. And then we add the functional conditioning exercises like core exercises, other stretches, strengthening exercises, and so forth. So if you're inflamed with your back, any disc inflammation or leg pain or arm pain, any type of acute irritation, inflammation, you should not start with exercises immediately. You should not try to push through an exercise if it causes any pain whatsoever. Let the inflammation subside, and then you work on correcting the underlying problems, structural problems, and of course muscle imbalances. So that's the answer to this question, and it's something that I follow with each and every one of my patients. So look to the next video tomorrow for the next Ask Dr. Walter segment. And if you're new to this channel, do subscribe to receive these videos on a regular basis, plus my other long form content that I put out there anyways about tips and strategies for spinal health, for stabilizing and strengthening the spine. Like this, you can bend, move, and lift normally without pain and limitation. So don't forget to subscribe. tap the notification bell, and continue on your learning on my channel. Go and check out this video right here to get more information about the type of care that I provide, which is corrective chiropractic care, and you can continue learning on my channel.